Vamos conversar hoje com Stefan Schwab, que é chefe do Departamento de Neurologia do Hospital da Universidade de Earlagen, Nuremberg, no Estado da Bavária, na Alemanha. Schwab vai nos contar sobre como foi o pico da pandemia do novo coronavírus na Alemanha e sobre a situação atual do país.
Yeah, I mean, the COVID crisis started in Germany in probably late February this year. We had to double the number of critical care, intensive care beds by law, which was mandatory for us all over Germany, which was quite a task, but it ended up with more than 15,000 intensive care beds. In parallel, we had very strict or relatively strict laws which were regarding the lockdown, which we had from end of or mid of March onwards, which I think was really effective. So no school, no any open or public whatever events and so on. And we were allowed only to meet in the family and not with others. And I think with all that, we were able to have relatively low numbers of COVID patients over the period now, which we see now. We had the setup to treat COVID-19 patients as well, but the idea was that we had in our hospital COVID-19 receiving units, which were in another part of our hospital. So almost all patients with COVID-19 went to this receiving unit, where we had a regular ward, an intermediate care ward, and the intensive care patients with COVID-19. They were more or less centralized in 3 units, which were dealing with those, one in the anesthesiology and 2 in internal medicine. So finally, I must say, we only had a few COVID-19 positive patients in neurology, and none of these really demanded any neurocritical care treatment. Telemedicine is, I think, one of the big, so to say, winners of this crisis, because in many centers and also in many diseases, telemedicine has shown to be an effective way to interact with the patient and the local hospitals. And that is, as you know, or as I told you already, we have a stroke network, which at that time did work very well with the regional hospitals. But I think now telemedicine will be also used in critical care, in cardiology, and in other parts of medicine. So I think telemedicine is something which I would really further strengthen, especially in countries where you have a big gap in experience between the local hospitals and the large university centers. We had one patient with a SARS-CoV positive meningitis. We have several patients who had intracerebral bleedings. We had some patients with stroke, but it's hard to say whether that is really something which is clearly connected to COVID or whether it's connected to the therapy. So it's hard to say. I mean, we now know that there is some endothelial damage which may be attributed to the virus. And our impression was that the number of stroke patients really went down during the high of the crisis. So it's hard to say whether we really saw more patients with, for instance, stroke due to COVID or less. So I would say at the moment we have a few complications which we may attribute to the COVID-19 infection, but for me it's not yet solved whether that is really causative or just a coincidental disease. Well, it's a stepwise return to normality, I would say. So it's one of the things which is somehow interesting is, as we are a federal state, many of our states have different, let's say, different velocity to return to normality. There are states up in the north which hadn't any COVID patients or very, very small numbers. They are more eager to come back to normality, and we in Bavaria and in Baden-Württemberg, which is also in the south, we are more cautious in the steps to return to normality. But it's a stepwise approach. So, for instance, from this week on, all our restaurants have opened again, and all the shops are open again, but it's mandatory to have a face mask, and otherwise there's still the idea that you should not meet with more than a few people from the family and perhaps somebody who's outside the family. But more and more these measures will be turned down. So normality is probably face mask, social distancing, and all this, which will be something which we have for a longer time, I think. Our impression is that you really have a problem there with the spreading of the virus, and something which may be a problem for your society as well as for economy. Well, to be political correct, I wouldn't say anything about the government there, but at least from what we hear in German news, it seems to be that the acute reaction on the COVID-19 pandemic was less accurate than it was for instance, in some states in Europe or in Asia. I would say it's what is really important is a combined strong action against the pandemic, and I think that is something which I think was the key in our country, that even though it's a federal state, all states within the federal government of Germany acted on a certain level the same way. What we see in Germany is that, for instance, the attitude towards nursing in the public, or the public opinion, has changed dramatically. So these are quotation our heroes now, and nurses have a much higher reputation than before the crisis. But on the other hand, let's say for doctors, I think one of the obvious things which has changed now and will be different for the next year is any international conferences probably will not happen, because it's almost impossible to gather as colleagues from Asia, Europe, Northern and Southern America on a meeting. So it is something which now comes to all these virtual conferences, and we had just has finished now, yes, the European Academy of Neurology, which was a complete virtual conference, but it had almost 40,000 registers. Very, very successful on the one hand, but the other thing is that all this social interacting, which also makes medicine in a way more attractive and important with these conferences, that is of course not possible. And that's one of the major drawbacks, I think, for the conferences and the idea to meet friends as you in Brazil or other ways, or other parts of the world.